Good evening, I'm Courtney Brooks, and welcome to Ask the Specialists. Tonight, we ask the senior care specialists on CMU Public Television. Thank you for joining us tonight on Ask the Senior Care Specialists. Now, this is a live program here on CMU Public Television, and our conversation is fueled by your questions. So tonight we are inviting you to call in your questions or tweet or send us a message on Facebook. Any questions that you have on Social Security or aging or elder care. So please pick up your phones or get on your computers right now. Give us a call, 1-800-727-9268. Send us a tweet at WCMU_AskThe, or go on our Facebook page of Ask the Specialists. So right now I'd like to take the opportunity to introduce you to our two specialists who are here live in studio to answer your questions. We have Shannon Patrick and Barb Frankenfield. Thank you both so much for being here.
Thank you for having us.
Now, Shannon, you are with the Social Security Administration.
Yes.
Can you tell us a little bit about what you do on a daily basis?
Sure. Of course, Social Security has many aspects. There's a retirement one, which everybody's familiar with, but it also has about a third of the benefits that get paid to survivors and to people who are disabled. We take black lung claims for the Department of Labor. We take food stamp applications for the Department of Agriculture. We take Medicare applications for the Health Care Finance Administration, or the Center for Medicare and Medicaid Services. And we run what's left of the welfare programs under a program called SSI.
Perfect, thank you. So any Social Security questions that you may have this evening, Shannon will be there to take your questions. And Barb, you're with the Isabella County Commission on Aging. Can you tell us a little bit about what you do every day?
Sure, we work really hard to keep people independent, provide resources so they can stay in their own homes. We also provide opportunities for volunteers. Volunteers are the lifeblood of our agency, as they are most human service agencies. And we also provide programs so that people can enhance their health, can learn new things, and we try to continue to break down the myths and stereotypes of aging.
Okay, wonderful. So again, we invite you to give us a call at 1-800-727-9268. You can hear the phones ringing already, which is great, so please keep them coming in. Let's just start off with something pretty basic, Shannon, if you don't mind.
Sure.
Can you explain how the Social Security insurance program works?
Yes, Social Security is an insurance program, and it's based as you would pay into a private insurance program with whatever costs they charge you for insurance. You pay into the Social Security system by taxes. Workers pay 7.65% of their wages into the Social Security trust funds, and that's used to finance the three programs that we talked about earlier. If you're self-employed, you pay both the employer and the employee part, so you're paying a total of 15.3% of your earnings, of your net profit into Social Security.
Okay, wonderful, thank you. And Barb, we have a question here saying, I think my partner may have Alzheimer's disease. How can we know for sure?
You know, we're seeing a lot more of that, particularly Alzheimer's, the dementia type Alzheimer's. And what we suggest is a geriatric assessment, which includes physical tests and psychological tests, and then the neurologist would meet with family or caregivers or friends, whoever the client would like. But a geriatric assessment is really the best way because it rules out anything else that may be able to be treated, and then they're better able to say this may be an Alzheimer's type dementia.
Okay, now what kind of stages are there for Alzheimer's?
Say it again,
What
please.
are the different stages?
Oh, there's mild, medium, and then late stages. And really they have some different types. Sometimes you'll see 7 stages, sometimes there'll be, if you work with the Alzheimer's Association, 7 or 10 stages. But there's mild cognitive impairment, then it would move into more the medium stage or the middle stage, and then into the late stages where it really becomes difficult to maintain any kind of activities of daily living at that point.
Okay, wonderful, thank you. Now we have a tweet that came in saying, is it true that baby boomers can significantly raise their retirement benefits by continuing to work in their 60s?
They absolutely can. there's something that's not well advertised. It's called delayed retirement credits. Many people know that you can start retirement as early as age 62, but if you wait longer until your full retirement age, and for most people coming on the rolls right now, that's age 66, at which point your benefits are not reduced. If you wait past age 66, you can get these delayed retirement credits, which are about 0.2% per month or 8% per year. And so if you wait from, say, 66 until age 70 when the delayed retirements end, you can add 32% to your benefits. It's a huge advantage to people because, again, in terms of the American population living longer, many people will find that that is a very good way to secure not only their own retirement, but also to provide for their survivors in the case of their passing.
Okay. Now another caller here, this time from Helen, is asking, does a pension from a disability VA benefit affect current Social Security benefits?
No, it does not. Some pensions do, but that is absolutely one that is not affecting.
Okay, wonderful. Thank you. Now, Barb, here's another question for you. I suspect my mother may be dealing with depression. What are some of the signs?
I think some of the signs of depression would be a loss of interest in any kind of activity. It may include a change in hygiene, where they're not taking care of themselves. It may include a change of eating habits, eating too much, not eating enough. Just a general withdrawal from activities. And I think if somebody's worried about that, then I think what they want to do is talk, obviously, to their parent and talk with the parent's permission, talk with a physician and see if there can't be something done either through a therapy or counseling or through a medication.
Okay, wonderful, thank you. Now, Shannon, we were talking a little bit earlier before the show about all of the resources that are on the Social Security website. Can you please expand on that a bit
It's
for our
an
viewers?
absolutely terrific place to start. The website allows you not only to get information to plan retirement, but it allows you to file claims and appeals. You can file for retirement, you can file for Medicare, you can file for spouses benefits, you can file for disability, and if you need to, you can file an appeal on the website. In addition, there are places where you can get hundreds of forms and dozens of pamphlets. There's a frequently asked questions section available to people. If you have the question, you can almost be assured somebody else has also had that question. It's really user-friendly, and the nice part is it's available 24 hours a day, 7 days a week. That's way more advantageous than trying to get through on the phones.
Perfect. So if you'd like to get some more information, you can always give us a call, or you can also check out their website. We have a couple more questions here for you, Shannon. This one from Leelanau County. Do I need supplemental insurance when I begin to draw Social Security?
Yeah, I'm going to ask Barb to answer this with me, but there are gaps that do exist in Medicare coverage. One of them are these things, for example, and dental care in general is not covered. There is a large group of plans that supplement, that fill in the things that Medicare doesn't cover, and as a group they're called Medigap policies.
Okay.
They take care of hospital premiums and they take care of the deductibles under the plan. What do you want to add to that?
I think I would just remind people that they need a supplement if they have Medicare. So if they draw early Social Security but aren't on Medicare, then they would need to look for some other type of insurance. But a supplement is always a good idea, and one supplement with Medicare.
Okay, great. Thank you for your question. We have another one coming in from Alpina. What is the difference in the amount paid in Social Security if you retire versus receiving disability?
Well, the amount that you get in disability is figured as though you've reached your full retirement age at the point you became disabled. So there's absolutely no reduction in disability. If you wait long enough, that is, for people coming onto the rolls right now, till age 66, there's also no reduction in your benefits then. If you choose to draw your benefits before your full retirement age, the reduction is about 0.5% per month. So that would be about 25% at age 62. So again, the difference between the two can be significant. But the primary advantage on qualifying for disability is that you get an unreduced benefit, and you also get Medicare 2 years after you qualify for cash benefits from disability.
Okay, great, thank you. Barb, maybe we can talk for a little bit about the Isabella County Commission on Aging. Can you tell us a bit about all the programs that you have available?
I love talking about the Isabella County Commission on Aging. I think we have programs that help people stay in their home. That would be, our umbrella program would be the social workers or case managers, and we have licensed social workers who help people through a myriad of problems and suggestions, and we make known to them resources. We have homemaking, personal care, respite care program, caregiver trainer that is specifically helps caregivers. One of my very favorite programs, and I think one of the best programs in the United States, is a foster grandparent senior companion program. These are programs that provide a stipend for low-income older adults to help children with foster grandparent program and adults with a senior companion program. And that's a program that touches not just the foster grandparents and senior companions, but touches the children, touches family, touches the community. It's a program that, over and above any funding they ever receive, does far above that amount of good. When you talk with the foster grandparents and senior companions, they will tell you that it's wonderful the connections they have with people, but the best thing about the program for them is what they get out of it. I'm sorry, what they give, and then what they get back, what they receive from the volunteering that they do. We have Gold Key volunteer program, and again, volunteers are the lifeblood of most agencies. So the volunteers our volunteers deliver home delivered meals, they answer our phones, they do data entry, they are friendly visitors, they work in all aspects of our program. It's a terrific program. We have a beautiful new building thanks to the generosity of the community, and we are able to provide all kinds of activities. We have yoga and Tai Chi with Central Michigan University, with the Senior Student Activity Center, University Recreation. We're able to offer a water aerobics program for people, which is wonderful.
That's
because
fun.
Obviously we don't have a pool at our place. But all kinds of opportunities. We also have a beautiful building that we love for other groups, particularly nonprofit groups, to use. So I think we touch a community that has been very generous to us, and that's a good thing.
I want to get my 2 cents in on this one and say that in terms of the place to go for help with Medicare, the Commission on Aging is absolutely the very best place to go. We send them to individuals who are interested in enrolling in the prescription drug plan or need help with problems with Medicare to the Commission on Aging, because they're not going to steer them to a particular plan, and their help that they provide is invaluable. The Medicare stuff is wildly complex. They are clearly the best place to go for it.
Well, it sounds like you have a lot of great programs and activities, and it's just a great
Great
place
staff.
all around.
It is.
Now, for those of our viewers who live a little bit farther away from Isabella County in mid-Michigan, are there other organizations like yours that are, say, a little farther away that you
Sure.
know of?
Every county has programs or services for older adults. We are a Commission on Aging. Some of them are called Councils on Aging, some of them Senior Services, Department on Aging, but every county is set up by the Office of Services to the Aging. That's our Lansing, that's the state program. Every county is set up so that there are services for older adults.
Okay, thanks, Barb. Now this one is for you, Shannon.
Sure.
This is coming from Lakeview. When you are ready to apply for Social Security, how far ahead do you need to apply? What do you need?
Okay.
And when do the payments start?
Okay, that's a great question. For retirement benefits, we can take an application up to 4 months before the first full month that you're 62, or any time afterwards. Okay, the application really is very easy. You can apply for it online again, and it gets processed for the most part literally at the end of the application. The questions that they ask are very straightforward. The only things that for a retirement application that you might need occasionally would be military discharge papers in a few cases, or your last year's W-2 if you want the wages from last year credited to your retirement benefits right away. The time that it takes is probably no more than 15 or 20 minutes to file an application. Of course, we take applications over the telephone. We take applications in the office. We have appointments if you need them or want them. We try to make it as simple and easy as possible.
All right, wonderful, thank you. Coming from Manistee, a caller is asking, why is it that they take away Social Security if you go to jail?
The Congress passed specific laws to do that, and I think the intent was that the taxpayers are funding your stay in if you're incarcerated, and they didn't think that it was fair to get benefits from two different sources.
Okay, great. Now, would you be able to discuss, I guess, in layman's terms, what does disabled mean? Caller from Manslow.
Okay. The law says that to qualify for disability, you have to, it's not your medical condition that makes you disabled. It's the inability to work, and that's the key. You have to be unable to work at any job at all for a period of at least 12 months or have a condition that's so severe that it's expected to result in death. If you want to talk about straight odds, if you're just rolling the dice, your chances are only about 1 in 4 that you're going to qualify for disability because that definition is so difficult. We would say to you, you can substantially increase your chances by providing additional medical evidence at the initial interview that you have at home. You don't have to go to the doctor. You don't have to pay for the medical records, which can occasionally be quite expensive. If you give us the sources for your medical treatment, we will contact them and you won't have to pay for those. Again, in terms of qualifying for disability, the system is made difficult because, again, they don't want people who have short-term disabilities to qualify. There's other benefits that are available there. It's the long-term benefits that are set up to deal with through Social Security disability.
Okay, great, thank you. Caller from Traverse City was hoping you could discuss a little bit about the Medicare gap.
Okay, well, if there's a will, there's a way, and one of there's new scams that come up every day. One of the ones that we're seeing right now concerns people who are being offered prizes if they'll just supply their Social Security number to these individuals. Don't ever give your Social Security number out. If you're called by Social Security, we already know your Social Security number. So that's not going to be an issue or a problem. Just treat your Social Security number as highly prized information and don't give it out.
Okay, wonderful.
We have some of the same concerns because we've gotten some folks calling us saying, somebody called from your agency, from the Commission on Aging or Council on Aging. They said that they wanted to help us with our insurance and they wanted our Social Security number and Medicare number. We say the same thing. We will never ask you for your Social Security or Medicare number, and don't ever give that information out. So we're finding what people are saying, or what folks are hearing, are people calling saying, we have a great deal for you with insurance. We can save you a lot of money if you just give us these numbers. Don't do that.
Don't do that. Sounds like there are an awful lot of scams going on out there. Those are pretty scary.
It's very scary, yes.
And it's very difficult for us to get you your money back. Sometimes we don't get your money back.
And we don't want that to happen
Not
to
at all.
anyone. A coworker and I retired 1 month apart. He receives $7 a month more than I do. Do you know why that would be? This caller from Oscoda County says that they both have the same amount of years earned.
Again, a difference of $7 for two people who paid exactly the same amount, who were born exactly the same year, is very possible. That 1 month can make a $7 difference in benefits. But the calculation of that, it can be very complicated, and I would say to you, there could be an awful lot of answers to that question, and there are several different things that could affect them.
Okay, thanks, Shannon. Now, Barb, a caller from Mount Pleasant, is interested in learning a little bit more about those delivered meals that you were talking about, one of your programs. Can you maybe discuss a little bit more about what that program is?
Sure. It's a great program. We have home delivered meals in other counties, other places they call it Meals on Wheels. But it's primarily for folks who are not able to get out to a meal site, because we encourage that, because not only do they receive a good meal, but they have some opportunity to socialize. But for people who are not able to get out, who are not able to prepare, don't have anyone to prepare, We will send a hot meal Monday through Friday. We also send frozen meals for the weekend. They're microwavable. And the really nice thing about many of our services, and it would be true across the state, is that there is no charge for the home delivered meals. We ask for a donation, and it's a federal mandate that we not charge for the meals. It's also a federal mandate that we ask for a donation, and folks in this community are very generous with the donation. Home delivered meals, and we cover all of Isabella County. Our program actually is the administrative program, is administrative body for Isabella and Gratiot counties with the home delivered meals program.
Okay, great, thank you. Another Social Security question for you, Shannon. This caller from Ionia served in Vietnam for 3 years. No Social Security was taken out. Will I still receive credit for it?
Yes, absolutely. The easy way to make sure, of course, is to provide your DD-214, which is your military discharge. But we actually are pretty good at being able to find those records, even if you don't have your DD-214. And if they're needed, you certainly will get credit for your military service.
Okay, great. Thank you. Callers asking about the homestead poverty exemption. Do children pay taxes at death?
I don't know the answer to that, and I'm not really qualified to say.
Okay, wonderful. Thank you. Let's see. This caller has VA health insurance. Do I still need a supplement?
What do you think, Barb?
I would say probably not, because VA should be the one that provides all of the benefits. However, that would be a question, I think, as a veteran with VA benefits. I think to call the local Veterans Administration would probably be the best thing. Somebody who has VA benefits does not need a Medicare D program,
right,
the drug program.
Right.
But I think I would be talking with the Veterans Administration.
Okay, great. Now, speaking of the Medicare D, the Medicare D donut hole, will the donut hole go on forever? The caller is asking.
No, as a matter of fact, the donut hole is scheduled to close through the Affordable Care Act. And what we've seen is that people right now are paying much less than they ever have been when they go into the donut hole. The other thing, just to suggest to folks, you may love your program, your Medicare D program, but please make sure that you get to a Commission or Council on Aging Medicare Medicaid Assistance Program to make sure that you have the absolute best Medicare D program that you can have. The Medicare D programs are changing. Some of the premiums are going up. They're changing a little bit in some of the programs. So it's a good thing to take a look and make sure that you are enrolled in the best program.
One of the things that Social Security offers also is extra help with Medicare Part D premiums. And again, you can check on that through the website or contacting the Social Security office. Sometimes it's considerable help with qualifying for the payments for Part D.
Okay, and that website is ssa.gov.
That's
okay.
right.
This is a little bit lengthier question coming in from Reed City. How does one declare totally disabled, homebound, permanently handicapped, a vulnerable senior citizen with traumatic brain injury by Michigan no-fault traffic accident get a Michigan caregiver to help in case of a fall or other home accident?
My suggestion would be, and it sounds like what they might be talking about is the possibility of somebody else paying for a caregiver, like maybe Department of Human Services. But where I would start with that is their local Commission or Council on Aging, speak with somebody who knows the Medicare Medicaid Assistance Program, and that person could walk them through the process of how they would have someone that may be provided either through the Commission or Council on Aging or through Department of Human Services or some other place. But I would certainly start with the local Commission on Aging.
Okay, great, thank you. Now this caller is asking, why do I have to fill out forms for assets for my 91-year-old mother?
That's an interesting question. I'm not sure that I understand why. It depends
Do you
upon
need
the
more
program.
information about it?
There could be a lot of answers to that one also. We do require for one of the programs supplemental security income and for extra help with the Medicare Part D, but not normally for anything that deals with regular Social Security.
Okay, now we only have a few more minutes left in our program. We've had a lot of calls come in here in the last few minutes, so we'll try to get through as many as we can, and even if some of them may be repeats, if we can briefly hit on those, please. A caller from Grand Blanc, I have disability. When and if do I file for Social Security?
As soon as possible. You have nothing to lose and everything to gain.
All right, wonderful. How much would I get a month if I follow up to the veteran who served 3 years in Vietnam? That's a follow-up to that question. How much would I get a month?
I don't know the numbers exactly off the top of my head, but it's comparable to wages earned at that particular time. And there's a part of the formula for calculating those indexes. That means that they're adjusted for inflation. So they're worth significantly more than at the time that they were actually earned.
Okay. Caller from Manistee, does Social Security have a record of what was paid into a retirement plan annuity?
In some cases, yes, but that will depend upon a lot of ifs, ands, and buts also.
Okay. Caller from Lapeer, both my husband and I lost our Medicare cards. How do we get another card?
Easy. Go online or call the office, and it'll take about 2 minutes.
Okay, easy is great. 2 minutes is
Easy
great
is
too.
easy.
Now, Barb, Meals on Wheels, what are the qualifications to get that?
A person usually must be homebound, have no one else to provide a meal, be unable to, a person doesn't have to be totally homebound, but primarily be unable to get out to a meal site and have no one to provide a meal.
Okay, great. Caller from Alpena, how do I report someone on full disability who is working full-time for cash?
Call your local office. There's an office in a Social Security office in Alpena. They will take it and make an investigation.
Okay, so they can look that up in the phone
Absolutely.
book or on the website,
Absolutely,
ssa.gov?
they're on both.
Okay, wonderful. Now we have a caller who is 49 years old and can't get Social Security or disability. They're wondering, how can he?
Oh, that's so difficult. There are so very few places that we can refer people because many of the benefits that used to exist were eliminated by welfare reform back in 1996. I don't mean to be crass. An individual can file for benefits again and try over and over to see if they can qualify. Sometimes the medical situation changes, and again, there's no charge to filing with Social Security. Immediately, though, if there's no things, again, you may very well have to contact the Department of Human Services or churches.
Okay, great, thank you. Unfortunately, we ran out of time. If we did not get to your question this evening, please visit our Facebook page, Ask the Specialists. And again, thank you, Shannon, and thank you, Barb, for being with us tonight. And thank you to our phone volunteers and for you to tuning in. We hope you join us again next week as we Ask the DNR. I'm Courtney Brooks. Good night.